If you're thinking about reversing your BBL today, Beverly Hills-based double board certified Dr. Yovino explains what makes BBL reversal or BBR look beautiful or not. Dr. Yovino, welcome to Beauty Seek.
Thanks for having me.
Beauty Seekers, remember to stay to the end because Dr. Yovino is going to reveal the one thing that determines what makes or breaks a beautiful BBL reversal or BBR. Post-procedure. Dr. Yovino, beautiful or not, a BBL reversal result where the patient is smaller, but now has a still visible shelf or loose skin or regular contour.
So we try not to get into that scenario, right? We're trying to have them happy, and I think that's where the plan is very important to not get there. But at 3 months, taking pictures, comparing it to before, and I really analyze all these zones, and we look at it, and we say, okay, rarely is there like still a shelf, right? That one's, and I find easy to take care of, right? That's usually done. Is there still too much projection in the central component or too much in the lower outer part? So if we're looking at the butt and the bottom outer part that's too wide here, we're trying to take that in but not causing a depression, right? That might still be too wide. Then we might consider doing more. And, that's where we say, okay, is more in the cards? And is that taking a little bit more going to get you to your happy place? Or is it going to cause a new problem? Is it going to cause more shadowing in the area or some loosening of things? And I'll convey my concerns, or I'll tell them, hey, there's a risk for that or not. And then we decide, hey, should we be moving forward or not with it? But yeah, I mean, like, most of these things are approachable and can be addressed in a secondary procedure. The skin stuff is a little different story. Like if there is some hanging skin, well, usually that is only addressed by skin removal, and that's a little challenging in this area. From an incision standpoint in the buttocks or around the buttocks.
Dr. Yovino, before you let us know what truly makes a BBR successful, can you share a patient story that really brings the BBR experience to life?
Some of these patients, I think of a few of them, but one who was like, I'm so tired of being asked, where'd you get that BBL? Where'd you get your BBL? Or where'd you get that done? Right? And they're like mortified, right? At being asked this in public. Or they feel like they're going out and they're getting stared at all the time. Everybody's looking at their butt. And they're so self-conscious about it. They can't find the right clothes, right? They can't get their pants over the butt, right? It's like everything's sticking out. They can get, there's room back there, right? Because it's sticking out so much. So they can't find the clothes. They're just socially having problems, and it's really affecting their life, right? So that part can be really satisfying for patients, right? Not only is it like, hey, we're reducing it, and they're happy about like their new size and shape and stuff, but now they can go out and they're not getting attacked, right? They're feeling comfortable in their skin, right? But comfortable in just their day-to-day life. And that's always very satisfying to hear from patients like, oh, thank you so much. I'm finally comfortable, being me again.
Before we answer the big question, does fat increase in size?
So I think the answer is yes, because patients, I've just seen patients, I've seen ones that have come in that really haven't gained weight, right? They had it done and years ago, and they might be a couple pounds, heavier, but not anything too significant. And they feel like their butt has grown, right? So I don't think the fat necessarily is dividing and making more. I just think that the fat cells are thriving, right? And they might be just taking on more fat and they're just kind of expanding. And definitely with weight gain, the butts get bigger. So those fat cells are growing in size. They're taking on more fat and expanding. I don't think that they're dividing and making more, right? They're just getting bigger. Just like when people gain weight, right? Like, their fat cells are expanding, this up and down. So for sure, these fat cells are growing in size.
But there's no way that someone who had a BBL could just lose weight and then lose their BBL. This requires a procedure.
Correct. They cannot go back to where they were before at all by losing weight, right? Like you got to have surgery to get it down. Now, I always encourage weight loss or at least being at your ideal body weight because then that's their best baseline. Fat cells are all at our like best size, right? And then that's how you get really the nicest result.
I love that. And before we close, can you share what kind of questions do you think a patient who wants a BBR should be asking themselves and their surgeon as they're on this journey to reducing their booty?
Well, I mean, they should be thinking about how much they want to reduce it. Like, how much really do they want to take it down? I think that helps get an idea. Like, if you just simply go, I want to be 50% of what I am now, right? And then you go, all right, well, how much fat was put in? There was 1,000 put in on each side. What's 50% of that? That's 500 cc's, right? It kind of gets an idea of like how much to take, like a target, right? Like how much to take off. To ask when they're finding the right surgeon, I think it's reasonable to say, hey, how many have you done? Right? Now surgeons may fudge on that number a little bit. It's possible and say, oh, I've done enough of these. Well, okay. You should look and see some before and afters, right? If they don't have any before and afters, then maybe that's not the right person for you. But somebody's got to start somewhere, right? Like I started with no before and afters, right? But I had done a lot of liposuction leading up to it. So a tons of before and afters with good liposuction. And I think that's the start. So you got to find a surgeon who does a lot of liposuction, in my opinion. So that's where having a lot of liposuction experience and a lot of good outcomes with liposuction is definitely the start.
Okay, this all leads us to the answer we've all been waiting for, Dr. Yovino. What is the one thing that increases the likelihood of a beautiful BBR?
Yeah, I feel like I should get a box and open it up, right? You have to listen to the patient. I always listen. I always have full conversations with the patient, but you have to have a surgeon who really listens to what you want. And if you don't know what you want, they have to really tease it out of you. The patient has to be able to say, I'm too full in the upper part, or I have this I'm too full in the middle outer part, or the lower part's bothering me too much. It's not really like, I'm just too big, fix it. Like you gotta be able to sit down with the surgeon and communicate what exactly you want. Right. And if you can't do that, then you show some pictures of what you like and then keep talking. So I really, that's it. The most important thing I've learned to get it right is to talk to the patients. And sometimes I talk to them 2 or 3 times, right? We have a consult and say, okay, am I the right guy for you or not? Are you comfortable? You want to move forward? Perfect. All right. Then day of surgery, I sit down and talk to them for a long time, again, about what exactly they want, what I think is good. Do they like that idea of what I think is good? Like we have a big conversation. Sometimes I'll see them for a pre-op before surgery. So it's not even the day of surgery. I have them come in or we do a virtual again, and we talk about this detail again. And we talk about we just go over all their desires again. And it's not unusual for them to like say something new, right? Because they've been thinking about it and they've been looking at themselves. Like, you got to have the conversation in depth about really specifically what they want. And then you got to try to follow that, right? Like then you try to execute what they're saying. So you got to listen. So you got to have a surgeon who listens.
Dr. Yovino, thank you for helping our beauty seekers understand what makes BBL reversal or BBR look beautiful or not. And today, I mean, you showed us that the surgery itself or the procedure itself is only part of a successful BBR. The consult, the goal setting, and the shared vision between the patient and surgeon are what seem to heavily influence whether the result is beautiful or not.
Yeah, it's a journey from listening, executing, and following up, and listening some more.
Thank you so much. This is something every beauty seeker should be thinking about. You've really educated us about BBR, and we really appreciate your counseling us on what makes a successful BBR and spending your time with us.
Oh, you're welcome. My pleasure.
Beauty seekers, we appreciate you joining us. If you like the education we're sharing, please subscribe to Beauty Seek